ACL surgery. ACL cannot be repaired. It is very rare cases, unless it's a partially torn, there is a chance to repair and give the native ACL. But most of the times the tear happens partially or completely. Patient comes with your complaints that my knee is not supporting. Even if it is a partial tear for a young person, the fibers are not sufficient to hold your activity, means it is a tear that requires reconstruction or repair. And most of the times ACL will be completely torn, that requires a reconstruction, means the ligament cannot be repaired. We need to pluck some tissue from your body only. That's we say it's a hamstring muscle. One part of the hamstring muscle, we'll pluck it and we need to recreate the torn ACL. So we'll say reconstruction of the ACL. So there is no other way. Sometimes we'll pluck your ligament, your tissues. Otherwise, it's then synthetic tissue is also available, but it's a little bit costly when compared to your native tissue. Native tissue is good, but synthetic tissue is like a ready-madely available, less trauma to the body, but costly, and more strength is also there. And people will think, oh, is it a major surgery? It's like a daycare surgery or one-day hospitalization. So it's a keyhole operation. We'll put a holes into your knee. To plug the ligament, there's a 1 to 2 inches incision will be there. Rest of the things will happen in the keyhole operation. Most of the times we use a bio button, means which absorbs on its own over the time, and a small button, bio screw and a small button to hold the new ACL. These are the implants we use routinely. Otherwise, 2-side screws or 2-side small buttons. So there are different techniques to do the ACL surgery. Mostly it is all our surgeries are arthroscopic, means a keyhole operation only. But the tying techniques, sometimes we'll use a screw, sometimes we'll use a button, what we say all inside. If the ligament is less, we'll use artificial ligament also. So there are so many techniques to do the ACL. The ACL as such is not a major surgery. There are a lot of people who get torn and they will go back to play. After reconstruction, again they will get it torn. It happened to multiple people also multiple times. So it's what we say, it's a revision surgery. High demanded sports person or anything, they will go back to the sports, again they will get injured, again we need to reconstruct. It can happen 2-3 times in a single patient also, sometimes for both knees. So it is not complicated surgery, it's a simple surgery. But if you get damaging revision is required, then it creates a more complicated surgery. So one day usually the patient will get discharged with proper physiotherapy instructions. For first 2 to 3 weeks, he will be advised not to walk with complete weight on his leg, with a partial weight or toe touch, what we say. Sometimes we use brace, it depends upon the person. And if associated tears like meniscus is also damaged along with the ACL, we'll restrict the patient. If we repair the meniscus, we restrict the patient from putting weight. We don't allow to put weight for 3 to 4 weeks, because the meniscus stitches what we use has to dissolve, and to get the strength, it takes time. So the suture healing at least 3 to 4 weeks. Till that time we won't allow the person to put weight. If it is only ACL, we'll ask the patient to toe touch for 2 to 3 weeks, then full weight bearing. And the protocol of the physiotherapy will follow. Depends upon the person, how much activity is required and what level of exercise he can do. The rehabilitation follow-up will be there. So ACL is a common injury. It's a young population, doesn't give knee pain. ACL surgery can be done because of people, if you can't able to perform what you have to do, then ACL surgery is required. It's not mandatory that everyone has to do that. If you have symptoms or complaints regarding lack of ACL, like giving away, not able to perform to the level of the activities, you need to consult, get a scan and check what is the level of ACL tear is there. If it is completely tear, there is no chance that will heal back. If it is problematic to you, it requires a surgery. If it is a partial tear or a sprain, depends upon the demand of the person and the muscle strength, you need to go for the physiotherapy, improve the strength. And for partial tears, we can also try PRP also, so that they will have a healing capacity. But it is not conclusive, that is the only treatment. Complete tear, there is no way like conservative management. They require surgery, depends upon their symptoms. Thank you.